Welcome to all our friends and families and all of us are non-members and partner organizations who have logged into our LSPC webinar on how to advocate for your loved ones inside and yourselves during this COVID-19 pandemic. Thank you for joining us today. My name is Ivana. I am the Family Unity Coordinator at LSPC, All of Us or None. Family Unity Matters brings together family members of incarcerated loved ones to provide mutual support, access to resources, and teach families on how to take action to fight for the rights of their incarcerated loved ones. We are a movement of incarcerated and formerly incarcerated individuals and their family members who organize to take leadership and challenge the injustice of the carceral system. Our purpose for this webinar today is to provide you with resources to advocate for your incarcerated loved ones, teach you how to file 602s for safe conditions, release and court actions for release, provide information, keep records of context, and gather documents. Teach you how to amplify 602s by contacting officials and elected representatives outside, how to participate in community actions and pressure prison or jail officials, access reentry resources for people released from custody, provide resources for you as a family member, and describe what Family Unity Matters is as a network within All of Us or None. To begin our webinar, I will introduce our wonderful panel and explain what each one of them will be speaking about. DeJohnette Shoemaker, she's our 2020 fellow at All of Us or None. She will be sharing on what it's like inside during a crisis like this and what incarcerated people need from their loved ones outside. Ken Oliver, he's our policy manager at LSPC. He will share on how to help incarcerated people advocate for themselves inside, review the LSPC coronavirus manual that LSPC has created for CDCR, and we will be following up with sample court petitions. Kelly Savage is the program assistant at CCWP. She will talk on what community organizers are doing to pressure CDCR and how to plug in to a statewide level. Henry Ortiz, he's our senior organizer at the All of Us or None chapter in Sacramento. He will be sharing on how to plug in on the local level and how to support incarcerated people who are coming out. Vonya Quarles, she's the executive director of Starting Over Inc. in Southern California and a member of All of Us or None. Vonya will be talking to us about reentry resources for people coming home and the family members during COVID-19. To everybody who has plugged in already, our speakers will be talking for 6 minutes each. Throughout the webinar, please feel free to type your questions and answers on the Q&A button on the bottom of your screen and or any comments in the chat button. Rita Himes, she's our LSPC attorney. She will be reviewing the questions and posting them to our panelists. Once our entire panelists are done speaking, we will be reading and answering the questions for the remaining 30 minutes of our webinar. Please take note that an email was sent out before the webinar with a resource packet that covers the subject areas our speakers will be speaking on, as well as the links to the resources provided today. We will start our webinar with DeJohnette, who will be sharing about what it's like inside during this crisis, DeJohnette, and what incarcerated people need from their loved ones.
So thanks everyone for joining us. So definitely life as they know it inside has changed. So you already are oppressed and you already are what limited freedom and movement you have has stopped. So no, we're in prison. We're in prison. We're super combined. Right now, the food, I can only speak for the women's prison because that's who I'm in contact with right now. But right now, their food is being brought to them. The level of stress is like super high. The small comforts, any small comfort in prison, if you can imagine what a small comfort is, it has all but stopped or slowed way down. So a small comfort is a telephone call. So now that calls are free, you would think that would be a good thing. But now that calls are free, that means more people has access to them. So they've slowed way down. They're probably letting 2 or 3 people out at a time, no more than 5, because there's 5 phones in each unit. Packages, I got an update from Kelly that you received. They're being brought to them, but we all know that's on the CO's time and their grace. We'll say their grace. They bring them when they feel like it, when the mood hits them. Shopping, every creature comfort they had has stopped and slowed down. All important things, very important things have been canceled. Surgeries, doctor's visits. The nurses are coming when they're coming. The nurses are not protecting themselves. They're not even really too much concerned about the inmate population. Things that are important to, I'll say us, because I was formerly in there, like our college. We're not being afforded to have our college classes, tests. The most important thing for lifers right now is volunteering. And although they're trying to accommodate us in those areas, it's not working. The quality of those hearings are going to be shit. It's just not going to be working. Hopefully this will be over soon, but right now it's just awful. When they say critical workers, when you hear things like critical workers are allowed out, that means critical. These people are essential to the prison running, and I mean essential. If a toilet gets stopped up, they may let you out to help you fix it. What do they need? They need to know that we're out here fighting for them. They need to hear voices when they call. They need to know that you're there for them. They need to know that they'll get through this. Like, they've been through so much in there. When I was in there, we went through the Legionnaires, the Valley Fever, the swine flu. So it's always a high stress situation. They're locked in like 24 hours a day. They're barely getting out, if anything, for a phone call. They're pretty much helpless and their hands are tied. They're very resilient. I don't worry you about their family. These ladies and men here are resilient. They're strong. They're survivors. They're going to get through this. They need understanding and patience. And then they have each other. They have each other and they rally. I mean, we rally in here. We get together. It gets stressful. Small things happen, but nothing too big that they can't get through it. They need to know that you, us, we are there, and that things like this are happening. They need to know that people are out here. So Kelly likes to always do a call to action, like if you can, write somebody, pay somebody, let them know you're here for them, let them know about this webinar, let them know that we have manuals, let them know everything, because that's it. It's all about communication. Class action 602s, they know how to do them. I'm sure they're doing them. I'm pretty sure they're rallying, coming together. And even though it's a high stressful time and it's a lot going on, just know that they'll get through it. With your help and their survival skills, they'll get through it. I think that's pretty much it, Vonya. I mean, Ivana.
Thank you, DeJohnette. I'm also going to mention that a different link was sent out to the new webinar. I'm getting messages that people are waiting on the other link. So please look at your messages and follow the new link to this webinar. If you know of somebody who's trying to get in, let them know that there's a different link to this webinar. Thank you very much, DeJohnette, for the information. I know that you're keeping in contact with some of the women inside, and that's where you're getting your information. So thanks for that. We're gonna follow up with Ken. Ken, you're gonna be sharing with us about how to help the incarcerated people advocate for themselves inside. and also talk to us a little bit about the coronavirus manual that LSPC created for CDCR.
Thank you, Ivana. I appreciate it. I appreciate the opportunity to be here. I'd be remiss if I didn't say we all need to take a moment to send our wishes to all the brothers and sisters, not only in California, but across the nation that are stuck in the cesspool of prison, which we all know is an unhealthy environment, specifically in California, where the medical department of CDC has been under receivership, federal receivership for the last 25 years. So our prayers and hopes and wishes go out to everybody that's stuck dealing with this corona epidemic behind the wall. With that being said, there's very, very little that a lot of us can do to affect what goes on within CDCR, excuse me. But there are a few things that we can do to offer support to our loved ones, our brothers and sisters that are behind the wall. One of those things is to encourage them and implore them to keep a paper trail of what's going on inside. We need to encourage them to put in requests. They're called GA-22 forms. This is what happens before you actually file a 602. You have to make a written request for gloves, for masks, for hand sanitizer, for all of the things that are necessary in order to keep themselves clean. This includes asking for single cell if you're double celled. This includes asking for officers to be mandated to wear gloves and masks everywhere they go when they come in, because contrary to many people's belief, it is the employees and CDCR that oftentimes bring in the viruses from the streets inside the very enclosed prison environment and cause people to get sick. I've bared witness to this myself with neuroviruses and other viruses that have come in through officers and nurses and prison personnel, and it spreads like wildfire inside the prison. So the very first step that we need to do is to encourage all of the people we know to keep meticulous records, because ultimately you can't file a lawsuit. You don't have any recourse unless you've created meticulous records, which means that you have to request all of the items that I named. You have to keep copies of those requests, because you need those things in order to file an effective administrative grievance. And this includes even asking for release. If you think you qualify for release, you have a certain type of offense where you're a year or a year and a half to your release date, you should be requesting through the administrative appeals process that you be released under the governor's current order, even though it's only for 60 days or 90 days to release. You should still make that request, because it may allow you to file a legal action at a later date. None of us knows where this pandemic is going to go, so it's important that we lay the groundwork now to protect ourselves in the future. And that starts with telling everybody about the request form. Once people file the request forms, typically you're going to get denied. Sometimes you may get a positive response and then there's no follow-up. Prison personnel typically don't follow up with the things that they say they're going to give you in many instances, especially when it comes to supplies like disinfectant and hand sanitizer, which is illegal inside prison for security reasons, they say. Once you do that, then you can file an administrative appeal. The administrative appeal is a prerequisite to any legal action that you take either in state court or in federal court. And I want to reiterate that. You cannot file a lawsuit. You cannot complain about being exposed to sickness, about your Eighth Amendment cruel and unusual punishment rights being violated, unless you file an administrative grievance first, saying that you asked for the things that you need: the gloves, the mask, to be single-celled where you're not literally double bunked with somebody, or if you're in a dorm living, double bunked with up to 10 or 15 people in a small, close proximity, where keeping the federally mandated 6 feet away from people is virtually impossible. So you have to be able to do that. And then once you file the 602 process, which it is a timely process, typically it takes anywhere from 3 to 4 months to go through the prison system, past the warden and up to Sacramento. You've now laid the groundwork to be able to file a legal action at a later date, either in state court or in federal court, assuming that you don't get any relief while you're in prison. And most of the time, you're not going to get any relief inside the prison, because the prison authorities typically don't want to address 120,000 people that are in prison and offer the type of relief that's needed, because it costs money, it costs resources, and they'd rather just turn the other cheek and hope that you don't know how to sue them in state and federal court. So those are some of the things you can do to encourage your loved ones when they call or write them letters and reiterate some of the things that I just mentioned. Also, Legal Services for Prisoners with Children has taken the time through our wonderful attorneys, Rita and Christine, to prepare manuals to help your brothers and sisters and loved ones prepare their request forms and to prepare their 602s and to prepare themselves to—
Ken, we're getting questions. Just clarify what a 602 and 22 are.
Okay. A GA-22 is a request form where you ask a officer or a prison official for a specific thing. So for example, you would want to tell your building officer or your dorm officer that you are requesting in writing to be given hand sanitizer. You are requesting in writing to be given a mask to wear, a clean mask on a daily basis where you don't have to reuse the same mask. You are requesting gloves to be worn around the prison facility. You are requesting that people who are serving your food, because in level 3 and level 4 institutions where there's cell living, most people now are being fed in the cells. And what that means is that you have people that you don't know preparing food in a kitchen for 1,000 people who oftentimes don't have the necessary sanitary masks and gloves on to prepare the food. And then they deliver this stuff all around the prison. And you don't know where your tray's been. The food is oftentimes not covered up. So you don't know exactly what you're getting in reference to cleanliness of the food. This also applies to the free staff that works in the kitchens and the officers that escort the other prisoners to deliver the food. So that's the first thing you need is a request, just a basic form. Every prison has them. Even if you don't have a request, you can write it on a piece of paper, submit it through the prison mail system, and ask for the specific things that you think that you need in reference to keep yourself safe. That goes from single selling to hand sanitizer to gloves and masks, et cetera, and so forth. A 602 is an administrative appeal. So what happens is that when you have a wrong that has occurred to you inside the prison system, you are allowed to file an administrative grievance. This is a very important document because you cannot file any legal action outside of CDCR against CDCR unless you filed an administrative grievance first. What does that mean? That means that if I decide to file a lawsuit tomorrow in federal court or in state court to say prison officials are deliberately exposing me to people who have COVID-19, the court would throw out my lawsuit as soon as they saw it because I did not file an administrative grievance with prison officials first. So I would encourage every single person that's listening to this webinar to tell people that you know that are in prison to file an administrative grievance once they filed the prerequisite of the 22 form. Does that answer the question, Rita? So getting back to the manuals, LSPC staff has painstakingly spent hours and hours creating manuals to send into our loved ones inside prison to help them go through this process that I'm explaining now. One of the manuals is called the LSPC Coronavirus Self-Advocacy Guide, and it's a guide that teaches prisoners inside how to advocate for themselves and what things to ask for. We've also created a manual called Tips on how to advocate for yourself for medical claims in case somebody gets sick or is exposed to the flu, or they have somebody that lives next door to them that's exposed. If those people aren't quarantined, you need to know how to advocate for yourself so you can stay safe. We also have a manual on tips how to advocate for yourself for non-medical reasons. It may not be a medical issue, but it may be an issue that affects your ability to be safe or affects your ability to have any numerous amount of things that you're allowed to have in prison, which one of the things is going to the canteen and being able to buy your own soap and shampoo, to be able to get dried foods, which we know are a lot safer than the prison foods. I would encourage everybody to send their prisoners, their loved ones, money if it's possible, so that way people can go shop and buy, foods that they're not the best quality, but top ramen sometimes is better than being exposed to vegetables or other types of food that may have been exposed to COVID-19. So those are some of the things that we've done. I think if you go on our website and a link may be shared during this webinar about how you can get these manuals, I would encourage you to get the manuals and send them in to your loved ones. And if you don't have that capability, you can contact us. And I believe some contact information will be given about how we can send the manuals in to your loved ones for you. But again, I would just reiterate one last time, when you speak to your loved ones, make sure that they write everything down. It's a pain to do it. Write it down, keep copies of your request, because you're going to need that at a later date to be able to file any other kind of action against the Department of Corrections for not keeping people safe during this pandemic.
Thank you very much for that information, Ken. Just for reference, we do have a LSPC COVID-19 manual for jails, for federal prisons, and also for out of state. So if anybody is going to need any of those, please let us know. We'll make it possible.
And they're in English and Spanish.
And English and Spanish. Thank you, Ken.
Yes.
So we're gonna continue with Kelly. Kelly, I know you are tirelessly doing so much work for the women and men inside. Can you share with the families that are listening at the moment, how can they get involved with other organizations to advocate for their loved ones, what other organizations are doing, and just how they can plug in and do their part outside?
Awesome. So obviously, first and foremost, it's knowing that your loved ones need your support as much as you need theirs right now, because we're all going through this, and this is new for everyone. So someone who may be used to lockdown in a previous situation, this is totally different, because now they're worried about you guys as much as you are about them. And so it's trying to find ways to get into them, whether it's a JPay, if they have that access, if it's a letter, sending in a book. They might not be able to get their means right now, so maybe they can't shop. But if they know that that is available for when they can, it will help them tremendously to have that relief, because they can't work right now. People who were able to handle their own responsibilities before are now locked down and unable to provide for themselves. And so what we're doing as one of many organizations, because the truth is there are so very many that are actually doing the work right now, we are working together as teams to make sure that we get information out there. Some of the organizations are California Coalition for Women Prisoners, you've got Ella Baker Center, you've got CURB, all working together on different media fronts, whether it is contacting our governor, whether it's contacting other people in Sacramento, contacting the warden. On a daily basis, somebody should be calling, somebody from every household that has an incarcerated person should be calling someone to put pressure on them to protect our loved ones, because we have a little bit of option with safe distancing, with access to supplies. They don't. And so they don't get to even talk to a sergeant during a lockdown like this, let alone a captain or a warden who is, of course, working remotely on 9/10 of a time. You're going to have those people not even in the institution. So if we are able to advocate for them, we're able to get them just a little bit of what they need, as well as let them know that there are people out here. We have a campaign right now, #Clemency Coast to Coast. Always remembering it's not about a sentence, it's not about violent, nonviolent, it's not about any other factor than these people are not safe and you're not providing the means that they need. And the truth is, no matter what institution they're in, no matter what their circumstances are, they're 100 times more vulnerable than every single one of us out here, because they can't do basic things like stay away from a nurse that they know might, be in contact with the outside world and be, have the possibility of an infection. They can't do that. They have to go to these people at all times to get any needs met, whether it is a glove, whether it is a roll of toilet paper. Right now, as we all know, we're struggling to get our basic needs. Can you imagine what it's like for them in there? So it's about getting with some of these organizations, whether it's I get involved because I get into All or None's membership team, and I learn how to advocate on a monthly basis with my family member, or if it's just for this moment now, and I'm writing to the governor's office and saying, what are you doing right now to ensure that my family member is safe? Because I have a right as a voting person, as somebody who pays taxes in this state, I have a right to make you accountable to us as individuals. every single person matters in this, and every single person can make a phone call or take a photo of yourself and put it on social media saying, what are you doing right now to protect, as well as, of course, taking those means to provide for those loved ones inside, whether it's a photo, because even if they are able to call, and thank God we have Global Telink allowing calls 3 days a week, as DeJohnette said, we're locked down half the time. They are locked down half of the time and don't have the options we have. And so they might not be able to make that call. If you can, try to make sure you take that call if you're available, because that's going to mean a lot to somebody who is inside and unable to do that. Some people are talking to their loved ones for the first time after 15, 18, 20 years. And so they're feeling a whole new set of vulnerability right now. And knowing that we're out here advocating for them and providing information like the handout that they are going to make available today, that's showing them one more group, organization, support a loved one that they care when they're feeling absolutely vulnerable right now, because they don't know where they're going to get information from. And so it makes it hard. And I know for some, having that opportunity to have any type of contact is so important. And as you look at what we're going through out here, maybe we're going to the grocery store and we're not seeing something on the shelf. Can you imagine them not knowing if they're going to be able to go to the grocery store next month? And as Ken said, it is not always guaranteed that it's safe to go into a chow hall. Some institutions are doing walk in and walk out with your meal. Other institutions are having staff bring it. God only knows how long it stayed outside. Ken is absolutely right. No one is sure what they even want to take from a custody staff at this point, because it is coming from the outside. It's not about hating one way or another. It's not about who deserves better treatment. The truth is, staff are just as afraid and have a job to do. And some staff are even getting in trouble for trying to make it more peaceful in their environment. So we have to just remember that regardless of what end of the aisle we're on, they all need support. And as that person gets off that lockdown, if they have an extra $10 on their books to be able to get more soap or get a little bit of food, it will help them. So please, if you can find a way to support some of the organizations sending funds in or sending funds into your loved one, it would be very helpful.
Thank you very much for that information, Kelly. And some of these organizations that Kelly is involved, that's working right now, signing petitions and doing a lot of the advocacy work, can be found on the resource packet that's going to be provided, has been provided, and will be provided at the end of this webinar. For everybody who is joining us now, please know that you can type in your questions and answers at the Q&A button on the bottom, and Rita Himes, our staff attorney, will be answering questions at the end of our entire speakers finish sharing with us the information. So we're going to continue with Henry. Henry is the senior organizer at the All of Us or None chapter in Sacramento. Henry, you will be sharing with us about how to plug in family members, how can they plug in on the local level, and how to support incarcerated people who are getting released at the moment. We know that CDCR is releasing a lot of people, and they have plans of releasing about 15,000 people more, right? Am I wrong?
Yeah.
How can family members help those people coming home?
All right. So how you guys doing? First of all, I want to get a shout out to all the families that are impacted by incarceration, that have a loved one in there. We've been bombarded with a lot of calls and there's business for parole letters, reentry housing. So just a few quick updates. Out here in Sacramento, we work with our collaborative partners from the Incarcerated SAC and the Anti-Police Terror Project, and with the lead public defender to file a motion to release 421 people that were incarcerated. We organized and fundraised a little bit over $600 to buy supplies, and somebody came through with an RV, and we were just passing out food, snacks, a little bit of clothes, little basic stuff that people need, getting them their phones charged so that they could get home safely. And in addition to that, CDCR right now, as some I know, that they're going to be releasing 3,500 people, and there's approximately about another 15,074 people that they're going to be releasing within the next 180 days, starting April 1st, from some of the information that I got from their department. As far as there's been 55 staff members in CDCR that have been contaminated with the COVID-19 virus. In Sacramento, the city of Sacramento, we've had 22 deaths. We have the highest death rate in the whole state right now. There's about 4 federal prisons that have 21 people sick. Right now, a lot of the guys, as I said, they're on modified program. They're doing sections at a time. They were doing like 2 buildings at a time. Now they're doing 1 building at a time for a yard. And then they were doing upper, lower tier. Now they're doing sections. They're breaking it down into sections. So it's getting really, really, really tough right now. Right now, what families can do, I really want to encourage them to first get familiarized with a little bit of the Title 15 and the DOM for our folks that are in there, so that they can fight, just like Ken was saying, start that whole process, right? If something happens and something were to really be done that was unfair, then we can move forward and take legal action, right? But we first have to start in a foundation. You have to log the times, dates, specifics, what officer it was, and log, because we all know there's some correctional staff. There's a lot of little politics, and they don't give our people the fair treatment, right? Ralph Diaz has been trying to change a lot of that mindset. He's really been more concerned a lot when I met with them. What are we doing for the families as community organizers and community-based organizations? And so that's been my focus now, is to support the families. And so I want to encourage the families to really read this book. It's called Fighting for Our Rights, right? It touches a little bit on what you can do, right? Some of the things you can do on how to get medical and mental health and dental care in prison, securing compassionate release for people who have medical needs, right? And filing non-medical complaints, a little bit about advocating for transfers and parole, suing for money damages, getting public records, right? Advocating for your loved one. And so there's a long list. We're going to be posting up a picture, and so be on the lookout, and then a link so you guys can, download some of the stuff. The book is pretty tight. It's got a lot of good stuff. It's about 100 pages. You can kind of section out some stuff and send it to your loved ones. We also have a newsletter that Paula just got done, so we're going to be posting that up. So send some of this information to our people in there. And so, another thing is that we're doing right now, that we've advocated and pushed to get all these people out. Now we have to prepare reentry because some of the talk is about releasing some of our folks into emergency hotels. They got some RVs that the mayor's put out there. And the thing is, do our people actually know that these RVs exist? There's some tiny homes, right? We're going to go work with them. This Saturday, I'm going to be working with a few people. They were coming together. Some are land, they own land. Other people have a few properties that they're currently giving reentry housing to 35 people. Most of the reentry homes that we researched are already packed and they're closed because they don't want to bring no new people because it puts everybody at risk. So that's already a tough thing. So we're going to be identifying areas in which people are going to start building housing. And really what we're doing is taking advantage of this opportunity as this crisis to start addressing some of the housing needs that our people have had for a long time, right? Now that all the money is going towards solutions, right? And the biggest solution that we need is to get housing for our people. So I also want to encourage our families, a lot of families from down south that reached out, connect with our chapters. We have chapters in Bakersfield. We got a chapter out there in LA. We got a chapter in Orange County. We got various chapters, a chapter in San Diego. So if you guys are interested, reach out to us so that we can connect you to the head representatives of each chapter so we can bring communities together, get you guys training, and get you guys supported so you guys can use turn tragedy into a calling of standing up and advocating for our community. You guys can also look up our website, and we also have numerous Facebooks where All of Us for None Sacramento, but we also have the main All of Us for None in headquarters out there in Oakland. So be patient with us, keep pushing. I want us to really take action, because organizations, we only have so much staff, we only have so much resources to be able to carry on so much. And as coalitions, we have that much of a power. But now when we bring the families and we show them how we're organizing, not only as individuals and organizations and coalitions, we're building a broader movement, right? And so that's my main goal, is to empower the families to come together and start taking action and supporting some of the efforts that we're all doing collectively.
Thank you very much, Henry. And just so whoever is joining recently, I just want to remind you that the chapters that we have across the state are also listed on the packet of resources that will be emailed to the families who are on now, and also were emailed previously to this webinar. So most of the information that we are covering is in that resource packet as well. Thank you once again, Henry, for all the work you're doing.
Thank you.
Vonya, I know that you are working hard as well. You are the executive director of Starting Over, Inc., which is a reentry resource organization down in Southern California. Can you share with the families who are listening today about the resources that are available for the people who are coming out, and also for them on the outside?
Thank you, Ivana. And I just want to say thank you to all the families that are on the line representing their loved ones who are inside. And I just want to say thank you to LSPC. You guys have been doing this work for a long time, 40 years actually of doing this work. And I appreciate it. I appreciate the support that we've gotten from you as an organization in starting our All of Us or None chapter, which is the Riverside chapter. And when we have these conversations, I think you all were the first organization to talk about proximity, and that if we're going to find solutions, we have to be in proximity or center formerly incarcerated voices in this work. And so I just really appreciate that kind of foundation. So in talking about services or reentry services specifically, or COVID-19 action plans to try and bring people home, the conversation at the state level has become, we're going to release 3,500 people. And when you think about it across the state, that's not a significant number, but in communities that are often most hard hit by the devastation of mass incarceration, returning people home without reentry services being attached is cruel and unusual in itself. And we're talking about people coming home now who may or may not be infected. And so CDCR reached out about a week ago asking if community-based organizations would provide transportation to people who are being released who don't have family members who can pick them up. And so there's this list now that CDCR has of transportation. If people need that for their loved ones, that's available. We've been calling on CDCR to begin doing COVID testing on people prior to releasing them if they're showing symptoms. We haven't got any traction on that request yet, but we would like to be part of, and Starting Over is on that list for transportation. And we would like to provide reentry services to people while not jeopardizing the people that are already in our housing programs. So, so what that looks like for us is we intake, because these are our people being released and they need a place to go. And if they need a place to go and we have available beds, we want to bring them in. We had to change our intake process. So now if a person has a fever, we can't take them in. But if they don't have a fever, they're not showing any symptoms of COVID-19, we will intake them. And we have a room that we call, I hate to use this word because I hate it, but it's an isolation room where if they begin to show signs of illness, we can at least isolate them there until we can get some care without jeopardizing or needlessly jeopardizing other people. Starting Over isn't the only service around. There are so many community-based organizations who work with our people, with this particular population. And so we're in Southern California. So A New Way of Life is a service provider that's always been providing housing and reentry services to women. And they're still doing that. Starting Over, Time for Change Foundation, which is in both San Bernardino County and up in Oakland, provides housing and services for women. Starting Over provides housing services for both men and women, and I think we have between 8 and 10 beds available at this time. They are in Riverside County, and we have 4 beds available in LA County for men. In terms of other resources, I think the health departments right now are a significant resource, and oftentimes we don't think of criminal justice being part of the health department, but now more than ever, it is plainly, it's in plain view how critical it is. And so we're calling on health departments for protective equipment, giving us information on where people can be tested at. We're working with food banks to make sure that that kind of safety net that had been in place is maintained as much as possible. So that's kind of been the emergency work that we've been doing. And the advocacy organizations, they're still working hard. COVID-19 presents itself as a two-edged sword. On the one hand, we have this significant deadly disease running rampant inside our institutions. And then on the other hand, it gives us the catalyst we need to free people. And so I think it's a combination of those two things that make it so complicated. So in the county of Riverside, we're pushing for releases from the county jail system. And what our county decided to do was to open a county jail that had not opened. And they believed that that was going to be, I guess, in response to reducing the crowdedness or the overcrowdedness at the existing jails. They have not moved anybody to that jail. And now our advocacy had to pivot to show that just because you transfer somebody from one institution to another doesn't eradicate the issue at all. In fact, it helps to spread it. And so just that kind of agility, because this information is changing all the time and strategies are changing, we have to spend at least as much time working with advocacy organizations and learning more about it. We have created letters of acceptance that we're sharing with people who can be released if they have a letter of acceptance. We're doing that. I'm sure other community-based organizations are doing that to help people come home and come home sooner than later. And talking with people who are currently incarcerated, a lot of what we hear CDCR say isn't what they say. So I was on the phone with someone from Lancaster, and he said they get 1 bar of soap a week, and that it was always 1 bar of soap. So nothing has changed. He has stopped taking the meals because they're bringing meals to him, and he has no idea where those meals have been, who's prepared them. So he's lost a lot of weight. This particular person has 3 pre-existing conditions, and he has about 2 years left on his sentence. And so he's someone who we think should be coming home. In fact, I won't talk about who, I think everybody needs to come home. So putting that aside, though, there are certain people that have medical conditions that holding them in a place like this is tantamount to murder. Because if CDCR has control, it's supposed to also have protection. And if they're under CDC control, CDC is obligated to protect them. And when you talk about pre-existing conditions and all the other stuff that this particular person has, they should have released him already. And so how do we take what we learn from folks on the inside, use that to have conversations with CDCR through the other policy organizations doing this work, is a puzzle we're still trying to work on because we don't have the answers. NELP has a lot of information around employment and unemployment. So it's the National Employment Law Project, or NELP. And so on their website, they have information about who's eligible or not for unemployment. Our houses had about an 80% employment rate before COVID-19, and now we're down to 10%. So most of our people have lost their jobs. However, they may not be eligible for unemployment because of the length of time they've been home and their work history at home. So that's another challenge that our folks face. And then another resource, of course, is the Small Business Association CARE Act funds that are available through people's banks. So if you're part of a CBO or some other business, that might be another resource for you. And is that my 8 minutes?
Yeah, right. Thank you, Vonya. You have so much good information. Like everybody else, it's like you should have the mic for 10 minutes. But yeah, we are with controlled a little bit with the timing. We don't want to keep anybody for too long, but we're trying to give as much information for the family members who are joining us today on how to advocate. And like you said, you are writing letters too, and people can inform themselves by going to your website, right? Starting over. And like I mentioned before, these organizations are mentioned in the resource packet that LSPC has put together to send to everybody who has joined us today. And any other questions, our LSPC attorney Rita, she's going to be taking over with the questions and asking our panels, and also talking about all the resources that we have available for the families today. Rita?
Hi, I'm Rita Himes with Legal Services for Prisoners with Children. I'm going to start by sharing my screen. This is the manual on how to advocate for your incarcerated loved ones that we have included it was included in the reminder email that we sent out with the new link for the webinar, and we're going to send it out, a link to this. We'll send it out again with a follow-up email. And it itself is full of links to other resources. The book that Henry was talking about, Fighting for Our Rights, a toolbox for family members, actually that should be family advocates of California prisoners, gives a lot of very practical advice. A lot of the advice Ken was talking about documenting what you're doing. So it's a nice guideline, even if you're not, your loved one isn't in a California prison or is in a prison outside California, it could be very helpful. And then this is LSPC Coronavirus Self-Advocacy Guide is the guide that we created for incarcerated people. And I'm going to show you that. So there's one for people in California prisons, there's one for federal facilities, one for jails, and one for out-of-state facilities. The first page goes over, just how to protect themselves to the extent they can. Basic sanitation, please remind them of all that, to the extent they can. Try to sanitize and keep themselves healthy. The second one is what the institution should be doing to help protect everybody. And then we're encouraging them to file grievances if it's not getting done. And then the last 2 pages are a sample petition for release. This is not an official form. This is a form we put together to help people advocate for themselves. And it basically highlights whether they're at high risk for complications. Elsewhere, and especially in the jail form, it highlights whether they're pretty close to their release date anyway, so it'd be good to let them go to reduce overcrowding. It talks about, has them describe what the conditions are, why they're not adequately safe, a little bit about their reentry plan, especially if they have a place to go, and then why they're not going to be an unreasonable risk to public safety. And then then it has advice about sharing this even beyond the prison system. And then the form for how to advocate asks you to send that in to them along with this manual about tips on how to advocate for yourself, which is what Ken was talking about. And it's very helpful if you get information from the CDCR website about what they're supposed to be doing, and then that you collect information from them about what's actually going on and take notes. They might need your help to get records, like their medical record. And there's a reference here to our Fighting for Our Rights manual, how to help you do that. The next step, and typically you have to wait until you've gone through the whole grievance procedure, administrative appeal procedure before you file a court action. But there are, because it's an emergency situation, you can make arguments that it would be futile to wait because the procedure isn't fast enough. And we are going to be posting sample petitions at this link. And then there's information about how you might be able to get help from other outside legal resources. Now, there were some questions from people who are signing up for the webinar about, people in jail who are waiting for their trial, and then the trial got postponed and they're stuck in jail and they might end up getting coronavirus. So your public defender or appointed counsel should be helping you with that. I know the public defender offices up here have been trying to do mass, have mass release petitions. They should be arguing it for your loved one in seeking release before trial. They should be arguing it on the sentencing aspect, that the sentence should not include custody in part because of the coronavirus pandemic. Then there's this next section. It's about amplifying what your loved ones are doing inside by writing to CDCR and contacting your elected representatives. And it's basically, we don't have a legal right to demand release, but it's all about pressure and hopefully developing a law that will help people. And then these are a whole bunch of links about ways you can get involved in community actions, collective action to try to put the pressure on for release and for safe conditions for incarcerated people, and reentry resources for people who are released, and then resources for you, which includes food, housing, employment issues that you might be struggling with. So those are the manuals, and now I'm going to share some questions that were submitted beforehand, and I'm also checking the questions that are being submitted now. So one question is, well, what can we say to our loved ones inside to help them deal with the anxiety they're experiencing with the coronavirus, especially if they see that there is not adequate precautions being taken, or they're not receiving information.
And the panelists are to pick these up, Rita? Can any of the panelists answer these questions as they, okay. Is anybody would like to answer that question in our panel?
Hi, this is Kelly. I think, honestly, the truth is being very clear and honest with them about what you're going through as well, but also, engage them in what they can do right now. What are they doing in their rooms? What kind of things are they looking at? Are they looking at news all day? That makes them even more scared, because the truth is we know that we can ease their minds, letting them know what we're doing as well, because essentially we're locked down in another way. And, for people out here who aren't used to it, it's difficult for them too. And so if we just encourage them and motivate them that, everything's okay for ourselves, that might help them.
Yeah. Thank you, Kelly. Rita?
Any other comments?
I mean, I would say stay busy, right? Don't get too focused on the problem. The virus, we can't do nothing about it. What we could do is take precautions and keep ourselves safe and those around us safe as best we can. But at the same time, we got to live. We can't just let this virus be like a terrorizer that's going to just consume our minds and keep us stuck in stress. Like, I hit the news real quick, get quick overviews, and I shut it down and I stay busy and what I need to do, right? Take time to draw. There's a lot of great artists in there. There's poets, there's writers, there's people that can write. I used to write songs in there when I was in there. Every time I had free time, it was always a blessing, right? Sometimes some folks work out inside, right, in the cell. It's kind of hard when you're in a tiny cell the size of a bathroom, but people figure out routines, watching all different programs. I mean, you're limited with what you can do, but, that's where the artistic skills come in, doing some meditation, and really some deep soul reflection, reading some good self-help books to really help us process some of the triggers and traumas that might be a barrier for us. Preparing a parole plan, preparing to come home just in case things might change. This is a crisis. So what is the game plan? People need to start figuring out, okay, if I were to get out within next day or week, who would I contact? What does my parole plan look like, right? What does my relapse prevention look like? Just getting creative and doing different things and staying busy so that we're not consumed, and doing in-cell studies like college or personal studies to just keep the mind constantly fueled with positive stuff, as opposed to just, going on one with nothing but worries and stress and struggles that would just create more our harmful stuff for our minds and our bodies over time.
Okay. And the next question, there are a number of questions about people who have been trying to seek release through Prop 57, early parole, or SB 1437 resentencing and other provisions. And there's a lot of frustration that it seems like at a time when releases are needed, those proceedings are being put on hold. And I don't know if anyone has advice to address those concerns.
I'll chime in a little bit on that because I follow a little bit about what happens with the Judicial Council in California. Unfortunately, we're at the mercy of the Judicial Council. Even most criminal trial proceedings, which come with all types of constitutional protections or alleged constitutional protections, have been pushed back, like arraignments and timeframes for preliminary hearings, et cetera. So as a result of the lack of court employees that are working every day, most of the court dockets have been pushed back significantly. And I'm not sure if there's anything that we can do about that other than try to wait it out. There's no set statutory timelines for hearing a 1437 petition, for example. A lot of those things are at the mercy of the court docket. So I would just advise to be patient and to try to have faith in the process. Those petitions will be heard. But I think that we have to have a realistic expectation that most of the things that work on the slow wheels of justice are going to be slowed down even further. And there's just not a lot of recourse because the court is usually where you get recourse. And so it's kind of like going to the keepers to challenge the keepers, right? So I would just advise everybody just to be patient as we ride this out. I think things will pick up. Unfortunately, a lot of the habeas petitions and 1437 petitions and other things that don't have strict statutory guidelines are just going to be backed up.
I'm going to just say, I think it's a good argument to make to the court, you know, if you can get someone in the court to, you know, entertain your petition, that they need to, some of them are going to be concerned about trying to release people, and here's a legal way to do it. So I wouldn't give up on these procedures. I don't know what you do about the delay for the parole hearings, except maybe file a petition to demand the hearing, and, you know, try to just work in the argument that it will also help resolve the COVID situation. But all of this is kind of being creative and just trying to put the pressure on. There's not a clear legal process. If you follow, you're going to get your result. So, but just we'll include that in the petitions. I just want to say, we got a question about ICE detention, and I did not, we have not prepared a manual for people in ICE detention. I've also received questions about people in state hospital civil commitments. So I'm not sure, I will make sure we add at least a resource organization to the manual at some point. Because you're getting a link to the manual, you can check back and see updates to it. So there are a number of questions about people who are in jail still not convicted. And I don't know, Henry, if you've had experience with that, working with the public defender and trying to deal with people whose cases are being delayed.
Yeah, that I mean, it depends on the severity of the case. If it's a serious case, like a murder case or a life-threatening cases, you're going to be stuck there for a minute, right? I mean, if it's a minor case, you know, they might OR you, they might release you, right, based on the emergency. So it all depends on the case that folks are facing and the time that they're looking at. And in regards to ICE, I also want to make a community aware that we're working on a bill with Assembly Member Rob Bonta that addresses 3 issues regarding ICE. 1, to get them out of county jails and prisons so that when our folks do their time and what they're being punished, they're there to do time. They're not there to get repunished and taken to an ICE detention center, serve more time fighting their deportation, and then getting deported anyway, right? There's another one where we're keeping them from using law enforcement to do their work and to use state resources, city resources to do federal work that they're supposed to do. And then the third one is, addresses them about surveillance people and just kind of doing these raids unpredictably. So Senator Assembly Bota said that he's going to move forward, even though there's going to be a lot of bills that are going to have to carry towards next year. He said with that one, he's going to carry over with that. There's been a lot of families that hopefully we're going to do some research on. There's some wrongful convictions. There's issues with people who had wrongful convictions, people that are concerned about ICE, because there's been about 150 people that have been getting killed that go to TJ Tijuana because, you know, there's just a nature of the way people target people from America. They think we got money, we got resources, and they're trying to rob us and kill us sometimes. So there's a lot. I don't want to alarm other people like that, but yeah, just it all depends on the time that they have. You know, some people that might already got convicted now they have to go do state time. They might be stranded there for at least 30 days now because of the hold. And so they won't be able to go to reception to eventually go to the prison that they're going to send them from there. So it all depends on the nature of the case.
Okay, the next question is whether you need to have reentry housing in order to get out. I mean, formal transitional housing, or what are the other options that are acceptable in terms of getting a release?
I can take that one. I think that it's not required. I think sometimes for people that are coming out of prison, they will sometimes make a judgment call about them going back to their particular community or their particular family area, and they might require it. It seems that they're more in favor of the person being released to a reentry organization as opposed to going directly with family, especially if there's been a history of criminal convictions in that environment. But that's just from my experience of looking at people's papers and their parole plans and them saying that they need another place, even though they might have a place to go to, they still need to parole to a community-based organization or something. And it varies from place to place. And then at the county, it's even different. So CDCR has their parole plans policies, and the counties vary. We got 58 counties, and all of them can do something different. So we don't have a reentry collaborative in Riverside. San Bernardino does, LA does, and I'm sure a lot of other counties do, which tend to kind of bring service providers together to help create comprehensive reentry plans. And oftentimes, people don't have a place to go or don't want to go, or things have just changed dramatically. I mean, we had a guy who spent 37 years in prison. So his family, he didn't know where his family was. And most of his family had died off before he came home. He was in need of reentry services. So I think it varies, but no, it's not required that you have a community-based organization or reentry housing upon your release. It's case by case.
There's a related question about whether home confinement can be arranged. I know there was, I've seen reports about in the federal prison, home confinement being used as an alternative.
This is Kelly, and I think it's always good to remember that if your family member is somebody that you think might have a possibility of any type of support, letting them know, this is my address, my phone number. We have communications in different ways, making sure that they have up-to-date information so that if a blessing does occur, that they have that. Here's places you can go, home to, and make sure it's on file. Make sure that they have access to that information, because some family members are going to say, I'm incarcerated. Can they handle more by having me there? Do I want to ask and get their hopes up? Most family members aren't going to want to do that. They're not going to want to say, can you put me up too? I know you aren't working during COVID, but I might have an opportunity to get out a little early. Or do I want to get their hopes up that it is a possibility I could get out? Nobody wants to do that. Nobody wants to hurt their family members and make them believe that they have an opportunity that is nothing ever is guaranteed in incarceration, nothing. But if they know that they have options and they have availability, and CDCR knows that they have availability, when you write to the governor, when you text the governor, when you email the governor, there's so many things that people are doing, hashtagging them. My family member can come to my house today, so that he knows there's options. And even if it isn't your family member that gets out, every person we help get out saves somebody else that's incarcerated who can't help themselves at that moment.
I also want to clarify, from my experiences, the only ones that are mandated to have reentry housing are lifers. It's been a mandated thing, so I know most of the folks on the call are probably families that have a loved one that's a lifer. And so that might be a challenge. I mean, who knows? They might change things around, but the way they've been doing business from when I was in there, that was mandatory to do at least 6 months to a year now, because of funding. People are only staying between 3 to 6 months in some of these transitional homes, as opposed to 6 months to a year.
Okay, thank you. Another question is, how can we find out about the health status of our loved one? I guess if you're not able to talk directly to them. Is there a way?
Sadly, they're not going to tell you. It's a matter of writing, hoping that they're able to call. But even if you call the institution, they're not taking responses, even if somebody has a medical approval on file, because you have to have that medical approval. As you talked about in the outline, you have to have that advocate, with the current information. It has to have a current date, has to have your current phone number, it has to have every actual information that they can contact you at that moment to get approved to release any medical information. But even then, they're not doing it right now. And they're using the pandemic as their excuses for not following through.
The question is, I'm sorry, I don't know if Henry covered this. Are people still getting deported when they're released?
You know what, that's a good question. I think that's something that we definitely want to research, and maybe we can address it on the Wednesday webinars that the organization is going to be having. I know they're pushing. I see something where they're trying to keep people from getting deported right now because of the crisis. But I haven't heard no follow-ups. I'll research it and I'll report it back to our staff so that we can communicate it to the community.
Okay, there's a question, how do we get those packets to send to our loved ones? I think that's referring to the manuals. We've been able to send them in, and I know people are receiving them, so you can just mail them in, but if you want LSPC to mail them, you can email us at info@prisonerswithchildren.org. There was a mention of unemployment resources website, and there's a question about what is that? Just a reminder. I don't know if Vonya, that was you. Did you mention unemployment resources and how people can find them? I know the Western Center on Law and Poverty has a really good website. Also, Legal Aid at Work and the Ella Baker Center. And those are all, there are links to all those websites in our manual, but if anybody else wants to add something.
Just the National Employment Law Project that has some good information around COVID-19.
Okay, how can we stop the transfers to Tracy that are happening in the upcoming week? Any ideas? I heard that some transfers are being done to reduce the overcrowding in dorms in Solano, and that the institution, Tracy, that's DVI, right? There are no positive tests there yet, or I guess that might not include employees. That's all I know about it, unfortunately.
Generally, if it's an emergency transfer like that, there's not really too much you can do. There's ways to Fandango manipulate the system and say like, if there's an area there that there's health issues, like people with asthma can't be in this location, then you all of a sudden get on asthma, or some people they get on medication to avoid going to a hot prison area, right? But I mean, that's not the best approach, right? You don't want to get on all kind of medication if you don't need it. It's a tough one. That's a tough one. When they're telling you you're going unless you have a write-up pending, or a situation where you're in a hole fighting the case or whatever for a situation, or doing a shoe, right? Or a medical hold, right? A medical hold. Sometimes the hardships used to be honored, but they lost its power too. So that one's a tough one, especially when it's an emergency.
Do we know why the transfers to Tracy are occurring, or can we find out the person that asked that question? Have they heard about why this mass transfer is happening?
So I'll wait and see if we get a response. But I did read something that there was some transfers to reduce overcrowding in dorms, which is not a bad thing, but doesn't mean that's adequate.
Well, if they're not getting tested, is it just spreading the virus too?
Yeah, I don't know. Yeah. If that person wants to contact LSPC, I'll try to get more information about it. There's a question, what should adequate precautions look like so that we can tell those people inside what they should be expecting, or what's the healthy bar? And we do talk about that in the manual self-advocacy guide. There should be repeated throughout the day sanitizing of any surface that's being touched by more than one person. So that gives you an idea. So the inmates, incarcerated people should have the supplies to do that themselves, and the facility should be having their sanitation teams doing it aggressively. So that's one thing. Then we do have a copy. They had an influenza protocol for CDC, which required isolation of people who are showing flu symptoms, quarantine of people who are exposed to those with flu symptoms, and prompt testing and vaccination. So there's no vaccine, so that's a problem. And the testing, we have not heard that there's much testing going on. And you can see the numbers at the CDC website that there are not, just a small number of people have been tested. So they are not complying with what normally would be their response to influenza. And that means that all of the other sanitizing and hygiene and isolation and exclusion of staff who are symptomatic or exposed practices that are all discussed in the manual need to be strictly adhered to.
Anybody else wants to add anything before we close?
I just want to clarify. I just got word that for lifers it's not mandatory that they find transitional home. It's recommended, but it's not mandatory. So I wanted to correct that. Okay. That's it. That's
great. Anything else, Kelly or Ken or Vonya, that you would like to add?
Sorry.
Can I throw out another question? Sorry. Go ahead, Kelly.
I just wanted to thank the families for taking the time to want to educate their loved ones and find out information, because the truth is every time we have a conversation, they learn a little bit more and empower themselves and empower their loved ones as well. And most individuals incarcerated in the system do not realize how many advocates there are out here for them or means to get support. And so as we start to educate them about all that we're doing, it will help motivate and educate them as well, regardless of what their sentence is, how long they have, whether it's 3 more weeks, 10 more years, or life without the possibility of parole. Every single person needs to be empowered, especially now.
Thank you, Kelly. You want to add something, Ken? Okay. Rita, do you want to add something?
I was just going to say there are questions about, why are, quote, violent felons always excluded from the proposals for release and reducing overcrowding. And I don't know if any of the panelists want to address that issue, just as they've been excluded from a lot of the resentencing reforms.
The easiest answer to that is ignorance. There's a myth out there that people that have committed serious or what they classify as serious or violent crimes are prone to more violence, but in actuality, studies and statistics have shown the opposite, and that people who have committed a violent crime at one time in their life, usually upon release, are the least people to fall into the cycle of recidivism. So, all of us or none works hard to close the gap on those distinctions. We don't recognize those distinctions ourselves. Although sometimes we do support legislation that allows us to grab some of our people from behind the wall. At a time, we advocate fiercely for the release of everybody without classifications and these false dichotomies that the system often puts upon our brothers and sisters that are behind the wall.
That was a really, really succinct and good way to explain that, Ken. Thank you. And I think we've become overly reliant on policy changes at the legislature. And For them, it's expedient. It's easier for them to sell it when we make that false distinction. And so I think it's on us to push past that and to have those conversations with legislators and with our communities to change the narrative about who people are who have been convicted of violent offenses. And so we see it all the time in our policy work. It's just easier. People have gotten comfortable with the nons, or that whole kind of thing. And it was good for bringing people home, but now it's in our court, and we kind of painted ourselves into a corner a bit, but we can get out of it. We've gotten out of a whole lot of other tighter corners than this, and it's just time for us to start carrying that message that Ken just said so well out with us in our work, and engaging more families of people who are incarcerated because of violent offense convictions.
Rita, do you have another question?
I think that wraps it up.
Okay, thank you very much.
Before
Ken?
we go, Ivana, I know you're
Yes.
going to close out, and I don't mean to interrupt, but I do want to advise all of our listeners that we will be having these panels regularly. I know that Ivana will talk about what we do with the Family Unity Project, and I think that starting next Wednesday, I believe we'll have a One Community, One Mic webinar series to keep people informed about what All of Us or None is doing in the state of California and nationwide. So I would advise all of you to, and invite all of you to tune in so you can find out what's going on in the communities, because oftentimes our communities are left out of the conversations in the general news, and we don't get to find out what's going on in the streets. And that's where a lot of our people are at, and we want to keep everybody.
Thank you very much for that, Ken. That's awesome. And just a reminder to everybody that the All of Us or None member link is added as well on the on this resource packet. So please sign on, become a member of All of Us or None, and get the updates of what Family Unity and All of Us or None are doing to fight for the rights of all our people inside, and to train and teach family members how to advocate and how to get involved and how to sign petitions to advocate for their loved ones and get involved. So all of these organizations that have been present today, and Root and Rebound, I know has a lot of information on unemployment as well as resources. They're also a part of our, they're also on our packet for resources. I want to thank all of the families who have joined us today. And just a reminder, like Ken said, All of Us or None is going to be holding these webinars constantly to keep everybody informed of what we are doing and how everybody can get involved. So thanks to the panelists who took the time and all the information you have shared. Kelly, I know you're doing great work. Vonya, I admire everything you're doing. Ken, you're working very hard at the moment as well. DeJohnette, Henry, you're a nonstop. And Rita, you are awesome. So thanks very much, Mark and Tina and everybody who was part of the panel today. Remember that we are going to be sending the email, a follow-up email with the membership form to join All of Us or None, and a link to the resource packet. You can also share that with other family members, and or go to our website at LSPC, and we have all that information there as well. So thank you very much to everybody once again. God bless, be safe, be healthy, and email us anytime you want with any questions. We're here, we're answering letters, we're sending letters, we're still active, we're still working for you guys. So feel free to contact us anytime you want.